policies you know, if you want to look at curriculum here, that our curriculum now has that in high school, students have to have PE in grade 11 or 12. That's a policy that's promoting physical activity. If I'm making this up now, so please don't repeat this and say this happens, we could have a policy that says every neighborhood has to have a sidewalk, so that, you know, sidewalks with lights so that you can safely walk. We don't actually have that policy, but we could. You know, it's something that could be developed. You can think about the most recent benefits in terms of tax relief, that if you have your child enrolled in an approved program, you can get a tax benefit. That also fits at this end. So we do need to work at that end as well, that we can promote physical activity from a broader sense. You know what could also fit in here is reduced fees, 2-for-1 fees at, you know, public facilities that could be supported by the government. I could give you lots of ideas there. We can do that in person when we actually meet. So what's your role as healthcare providers? I've been telling you it's critical. Hopefully with some of this background information, you'll see what your role is seeing. You know, if you go back to this diagram here, you can see where you fit probably in the organizational or the community level. You can see where you specifically fit and what your role is in health promotion. So your role more specifically is to motivate and assist patients to change their less healthy or their unhealthy lifestyle behaviors, to be a primary source of information and advice, to help your patients weed through the bulk of information that's there, to provide that understanding, to interpret what there is. Sometimes, I think it can be difficult for people. There are so many different physical activity recommendations that we've heard about, and part of it's because you can be active at a light intensity, at a moderate intensity, or at a vigorous intensity. They don't understand, what is it, 20 minutes a day for what? And, you know, so you can help to explain that. I think that's a critical role as well. Keep in mind, I mean, your role, the average Canadian visits his or her physician approximately 4 times per year. So whether you're directly involved with healthcare at that level, or your services are recommended by a physician, so certainly there is that role. And well, the way this is designed, it's a minimal level counseling. It only takes 2 to 3 minutes of your time. If everybody is sending the same messages in terms of healthcare, in terms of policy, that we need to be more physically active, it'll be like the smoking cessation programs. We're being bombarded, so we, you know, just becomes like, oh, of course I'm walking and taking the stairs because that's what we're supposed to do. So your role is to actually provide this minimal level counseling, to find the 2-3 minutes, to make those available when you're working with your clients. And if you think about this, really, who do people listen to? Who do people trust for their information? You know, if you look at that, you look at Nova Scotians, this chart here shows Nova Scotians compared to Canadians. People listen to the Heart and Stroke Foundation. They find that information. It's got to be presented to them in a way that they understand. They're finding it useful and they're believing it. They listen to other health professionals. That's you. That's why it's critical that you're involved in physical activity promotion. They listen to their physicians. Interesting that it's a little bit lower for physicians in Nova Scotia than for other healthcare professionals. Certainly speaks to how well you are working. Participaction, they've listened to that. Not sure if you're aware, but Participaction is coming back on board. They've got a new campaign. Today is October 21st, 2008. I believe it's in November that it's coming out, so we're going to hear more of that, so that's great for people. They listen to researchers. I'd like to think they listen to me more often, but I'll live with that level. Athletes, we have no data on Nova Scotian. It is interesting. If you look at the Canadian level, people do look at athletes and wonder what they're doing and how they're doing it. Other thing people listen to, and maybe this is not specifically athletes, it wasn't asked, people will often ask the person who looks healthy. That's, you know, that's who they'll listen to. So keep that one in mind. So sometimes there's a whole lot of misinformation that happens. And not surprisingly, the government people don't listen to very often. So role of healthcare providers, I like this one. To prevent a heart attack, you need to take 1 aspirin every day. Take it out for a jog, then take it to the gym, and then take it for a bike ride. So if you look at that, it's really, we don't need we don't necessarily need pills or pharmaceuticals to help us be healthy. We need to be physically active. That's really what you should get from this. This slide actually refers to a study that I was also involved in where we actually sent out a questionnaire. We faxed a questionnaire to healthcare providers in the 9 district health authorities in Nova Scotia to find out what is currently happening, or what was happening at that time in terms of physical activity counseling. That framed what we're doing here. It's provided some of that background. And then these are some of the results from that, and what we've learned from that. What we did learn is that healthcare professionals recognize the importance of physical activity. Like most Nova Scotians, you certainly recognize the importance of it. Doesn't mean that they were always counseling for it or actively participating. Remember, knowledge doesn't always influence behaviors, but certainly recognize it's there. So I really don't have to probably sell you on why it's important to be physically active. You recognize that. We did discover a large variability in the amount of counseling provided, from as little as no minutes, and that's not totally a surprise, but there were some individuals that actually spent an hour in their sessions counseling, and then with lots of bits in between, a couple minutes, and it all really depends what somebody's doing. If you're a kinesiologist, that's probably the entire point of your appointment was to counsel about physical activity. So large variability in terms of that. Not that we can just have a canned message, but we sort of can in that 2 to 3 minutes, so we can have something that's consistent. What we did find out also is that overweight adults receive the most counseling. That people would say, oh, I definitely, or I spend more time counseling those individuals that appear to be overweight. Reality is we all need physical activity. Keep that in mind. We need to counsel everybody about being physically active. And sometimes the person who physically does not look like they're overweight could be really soft and squishy and might not have a whole lot of muscle, in that frame. They also told us in this study that there was a need to improve access to resources and training in physical activity counseling. And this is where Heart and Stroke Nova Scotia has stepped up and really put together some phenomenal resources and this training program. So what are your options? And we're getting close to the end now here for this what I'm feeling is a little bit of a long-winded presentation. What are your options? Well, we can start off with, if you look at this chart, the things that require less time, they tend to also be less effective. And then we go to that which takes a little bit more time and tends to be more effective. So the requiring the least amount of time and the least effectiveness is providing you with the community linkages. So you actually, when I talked earlier about what's available, that would be you simply providing the handouts. Patient education materials, part of your package. That takes a little more time because you would need to explain that. Then we get to the minimum interventions and the motivational interviewing. And these are all things for the workshop upcoming. Is that where I end, Fran?
That's great, Angie. I think you provided us with some wonderful information, some great food for thought. I would welcome people also who are accessing our workshop today online. Not to forget that we have some wonderful resources, some fact sheets around not only diabetes, but obesity, depression, and heart disease and stroke. Of course, fact sheets on the website, so you can download those even if you choose not to join us for a workshop, and that can be a wonderful resource that you can provide to your patients. Some great research and wonderfully readable and very accessible for a wide variety of populations. So I welcome you to register now for a workshop if you haven't done so already, and I'd just like to take a moment also again and thank Dr. Angie Thompson for being with us here today. So thank you so much.
Thank you.
Great.